going to get started. It's my pleasure today to present to you on the human services pathway. I'm also very excited to have Tammy Stanson in as our professional, our industry professional. She's going to spend the second half of this session talking to you about her program specifically, and then just her observations as we work with students to get them in. As we know, all of our students want to be doctors, labor delivery nurses, etc. And as a school counselor and as a career counselor, the work I did for many years, students really don't understand the access points and all the different career pathways that are available to them when it comes to the health science pathway. So we're going to take some time today to present to you just kind of that high level overview. I want you to take my PowerPoint. I kept it simple so you can manipulate it. I'm not going to lock it down at all. I want you to use my PowerPoint with the information in your classrooms and when you're working with students. When I have students in front of me as a school counselor and as a career counselor, they always want to be nurses and doctors. My nurses all wanted to be labor and delivery nurses, and the doctors all want to be either pediatricians or surgeons, brain surgeons. But our students don't understand that there's so many excellent access points that they can start that journey as they build into those careers that could potentially require 10 years and several $100,000 of education. And so our students don't understand oftentimes the grit that's required to even get into an RN program. And so instead of feeling like our students, we kind of think they might be overshooting maybe their skill set or their ability to grind that journey out, we want to open up those options to our students and hope that when they enter some of those stackable credential access points in the health sciences, they're able to get motivated and get into the work, in the thick of the work, and continue on their journey to be that RN, to be that surgeon, to be that pediatrician. Again, this is our Macomb Engage the pathways guides, we call them. So this is what the PDF looks like. You can print this. It prints really good in black and white as well. So I would ask that if you have the access to do that and you're working with students who want to go into the medical or the health sciences industry, you have this at your disposal to hand off to them. And it shows you a great high level overview of the job openings, median wages. We know money talks when we're talking to students to motivate them on post-secondary planning. We know that these are the top posting employers within our region in the United States. And then on the back of this PDF, you'll see all sorts of great just talking points for us to highlight with our students. And so please use that. The health sciences career pathways, I don't think this conversation is often used with students. It's not just about being a doctor or a nurse or making people feel better. Health science is a huge industry, as we know, and it's an industry that is not going to go away or be outsourced with technology. Many of our different career pathways are going to take a huge shift with the advancement of automation and technology. But we know that as long as we have people that have needs medically, this is going to be always in demand. And students don't have to think about going into the health science pathway to clean up blood or to do some of those not so glorious or glamorous types of duties when it comes to taking care of a sick person. There's all sorts of different pathways. So this is a great screen I want you to use with your students to show them, okay, you want to go into the medical field. That's the phrase they often use. Within that medical field, take a look at all these amazing options that you can do. And a lot of them have very entry-level access points for students. Students can go to 6, 8, 12-week training, a year training, and get right into a hospital system, who will then scoop them up and continue to pay to train them and advance them. So we want to have the conversations, not necessarily, okay, well, are you ready to go to college for 10 years to be that pediatrician? But where can you start? So when your education maybe takes a break, are you employable? Are you able to make decent wages? And are you able to provide for yourself? So you'll see we have support services. So these are screens that you can take from this PowerPoint and recreate, make them look more glamorous for your students, but please use these in your classroom presentations. So one of the pathways is the support services. That's a lot of entry level type of work and support services. We often hear people in this role referred to as techs. So physical therapy technicians are not the physical therapist writing the work, but they're going in to support the work of a physical therapist. This is a great sell for a student who doesn't feel that they can grind out a significant amount of education right away when they enter their adult world. So we have pharmacy aides, health educators, cooks, servers, patient representatives. Those are all different roles that assist our assist more of the professional people within the human health science pathway. What I want to do is direct your attention down to the education required. In my work, I found that many of the hospital systems in our area, Ascension, Henry Ford, Beaumont, they are now doing third-party employers for a lot of the support services work. So if you have a student that wants to be a patient transporter, work environmental services, work with the cafeteria or serving food to patients in hospitals, you're not going to see those postings on the major hospital websites anymore. They actually have, just like in education where we've outsourced subs, unfortunately in a lot of districts they've outsourced bus driving. Those type of ancillary support services are through a third party. So if you're looking to help a student get employment in a support service pathway, you're not going to oftentimes find them on the hospital websites. So I want to make sure you know that. The education is generally direct hire, on the job apprenticing. Our pharmacy technicians can be apprenticed directly through Walgreens and CVS. They can walk in at 18 years old and take a course online and apprentice as pharmacy techs. There's a lot of short-term credentialing available to students. And I'm confident that when a student gets into that short-term credentialing, they get some self-confidence, they enter into those support service roles, they're going to be exposed to all the other careers within the health science pathway. And the hope is that they're motivated to continue to grow and expand, and the major hospital systems will support that for them. The next area within the health science career pathway is therapeutic services. So this is where we have our physical therapists, our nurses, speech language pathologists, surge techs, trainers, home health aides, etc. In most cases, the education required for these types of pathways is going to be something from an associate's degree where there's a selective admissions process for a lot of our students to get into those entry-level therapeutic service pathways. Sometimes, and I know especially in the physical therapy, they have tech positions. It's unfortunate because the wages are very low. And we know that to become a physical therapist, you now have to become essentially a doctor. It's a graduate, postgraduate program in most universities. So oftentimes when our students want to become something within that therapeutic service pathway, we have to be very realistic with them, explain to them it's a grind. There's going to be selective admissions processes, which means you're going to have to take some prerequisite courses, specifically in anatomy and physiology, and some of those deal breaker courses, we call them, to make sure our students are competent when they enter in those therapeutic service pathways. It's not to say our students can't do it, but oftentimes our students are looking to work quick. And so if we push them into the support services and teach them how to stack their career and work continuously to get into one of these other programs, they're able to be working, doing the work that they love and they're passionate about while they're continuing their education. One of the, I would say, largest growing, especially with COVID and the pandemic, is biotechnology research and development. So a lot of our students who want to go into biology, chemistry, what does a biology degree get you? What does a chemistry degree get you, a 4-year? What does that look like? How do you get that paycheck in your pocket? How do you get employed? So these may not be students that necessarily declare that they want to go into the health science industry, but they love biology. They love working in their chemistry classes. They just don't know how that fits necessarily into a career. So this is a great growing large epidemiology, pharmacology. We have a lot of research assistants. One of the biggest, most popular one I've had students go into is going into biomedical engineering. So helping build different types of equipment to help treat patients in the hospital, building prosthetics, all sorts of different types of engineering, but with the body and healing people in mind. And so Wayne State has an amazing biomedical engineering program. So if you have any students that don't necessarily declare medical or health careers, but they have that mindset, definitely talk to them about the just amazing opportunities. And again, I guess I can't say we're post-pandemic, especially with the surge again, but with the pandemic has probably brought this awareness to our students that there's this whole field of research and development in order to help circumvent these types of situations in our country. So this is, most education for this, the education required for this is going to be a bachelor's degree, graduate level type of work. So we definitely have students that are very interested in this field of work, but there is going to be, quite an extensive amount of education for them. And so they're going to be working more on the desk side, computer side in labs versus helping patients, but they're still helping patients essentially. So we have diagnostic services. Diagnostic services range from entry-level certificate type of programs for students to students that have to enter into a selective admissions program at a community college and be able to transfer on. What I have learned in the hospital systems, a lot of students want to become, ultrasound technicians. A lot of our female students, just the idea of helping the delivery process or viewing, helping find out the gender of a baby is very attractive to a lot of our students, and they sound very excited and passionate about that, and it sounds really exciting for them. The problem is that there's a very limited amount of programming available in our region specifically to help train students in radiology, X-ray, diagnostic medical sonographer, which is the formal term of an ultrasound technician. It's not that those aren't available, it's just pretty tough in our region. We don't seem to have a lot. So I just want to make you aware of that. So careers in diagnostic services include MRIs, X-rays, ultrasound procedures, analyzing laboratory results, phlebotomy, which is actually only a certificate, which is great. That's a great entry-level position for students, and it actually pays really well out the gate. The education is going to vary in this category. So the phlebotomy is a certificate. It's usually you can get that through a non-credit bearing program. But obviously in the ultrasound technician, the MRI and the X-ray, it's going to require an associate's degree, and it's going to require that selective admissions process, which means your students are going to have to go a year into the community college, and then they're going to have to apply midway through to start that next fall to get into that program. So these programs are very similar to what you might know about a registered nurse program at a community college. I'm going to speak to Macomb County. I know I have a lot of out of county people right now, but I also worked in Wayne County and I'm familiar with their process. So specifically, diagnostic medical sonography or ultrasound technician is hands down, besides nurses and pediatricians, the most popular career pathway within the health sciences that students want. We do not in Macomb County have an actual ultrasound technician program. Macomb County has a diagnostic medical sonography program in which students start, but then they have to apply to Oakland Community College, and they will go over there as a Macomb resident taking Oakland Community College's final ultrasound program. They will take it at the in-district tuition rate, which is good. So they're not going to be, their tuition isn't going to be doubled because they're moving over to Oakland County, but they will finish the degree over there. So when you think about that, that's a very large pool of competition for a student who wants to go into that field of work. We want and we need students in this field of work, and we need professionals in this line of work. But a lot of my advice to my students is to look at picking up that phlebotomy certificate or picking up a certificate as a CNA or a medical assistant, so that you're able in the short term work in the health industry while you're working on some of these selective admissions programs that could take several years just to even get into the program. Years ago, nursing was very difficult to get into because in Macomb County specifically, there were years and years of a wait list. Baker College opened a nursing program, and we have Chamberlain College, and so it started to pick up. But for many years, students were working in retail, fast food, places that they weren't passionate about while they were just waiting to get the call to get into that program. So those are some conversations and things to consider. Teach your student how to stack their health science credentials, which also gives them an edge when they have to apply to these selective admissions programs, because they have a lot more medical based experience on their resume, perhaps over somebody else. So that will give them an advantage. So it's kind of like taking a lateral stop before you take that step forward. And that's a really great move for students. Then we have health informatics, known as medical records. This is a very diverse pathway. It's another way for students who don't want to do shots, blood, and all the other things that might go into the health sciences. It allows them to work with patient data. A lot of our IT students don't realize all of the work available to them in the medical industry. A lot of our students that look at IT, cybersecurity, those types of things, they just want to be video game designers. They don't realize that there is an entire arena for them within the health industry. So if you have an IT student with you and they're trying to figure out where they're going to land, definitely look at those. I looked at all the different major hospital systems, career or job posting forums, and there's always IT, coding, all those different types of health informatic type of professions available to them. So I highly encourage you to kind of, pull your IT kids in as well and show them that there's a lot available to them. We know that medical coders, schedulers, medical assistants, medical record technicians, a lot of those types of career opportunities exist for students within a year or less of education. So there's a lot of entry-level certificate and non-credit bearing programs in this region that you can refer your students to get into the health informatics pathway. And there's a lot of work. I know Beaumont and Ascension in the northern Macomb County pocket are building surgical centers like crazy, and they're all looking for different types of positions to fill, and health informatics is definitely one. So those are the different pathways underneath the health science pathway. High level overview for you all, but take this and run with it and design it to help the conversation with your students. I want to talk about the different access points when it comes to education and training. And then I'm going to hand this off to one of our industry experts. So I'm going to speak specifically to Macomb Community College, but in my experience working with Schoolcraft, Henry Ford, Wayne County, St. Clair Community College, I know all the different post-secondaries in the region. They all have a workforce and continuing education side. We call those non-credit bearing courses, and sometimes that has a negative connotation. But essentially what it is it's taking courses, getting training in the short-term certificate route. Your student cannot use those credits, however, if they wanted to go over to the degree route. But the beauty of those workforce and continuing education programs is that they're generally short, hands-on, concise, and they have excellent job placement. So oftentimes students, once they go through a continuing education program in the health industry, and they can enter into a major hospital system in some capacity, the hospital has a lot of in-house training programs. So if you go in as a ultrasound technician, but you want to learn CAT scan or MRI or nuclear medicine, they're going to put you through that training through the hospital system. So it's a win-win for our students. We just need to have them build some self-confidence in that career pathway. So this is a screenshot of Macomb Community College. This is their workforce and continuing education page. This is their non-credit bearing but certificate grading program. You'll see on the left-hand side, they have a very all sorts of different industry specific, but I clicked on the health tab to show you, and there is a plethora of certificate programs available. And there are also some that require selective admissions. So take a look at that. Macomb is obviously a great place to go. I started my whole career at Macomb as well as a college student. They have a lot of great opportunities, but I want to make sure that we highlight the other access points besides defaulting to Macomb, just so that you're aware. And in your different counties across the state of Michigan, those of you that are joining us today, you'll know that your community colleges all have something very similar. And then you have trade schools or career pathway specific schools within your region. So the Michigan Healthcare Academy is in Clinton Township. I actually have family that have gone through them. You'll see that the Michigan Healthcare Academy has CNA, CPR, home health aid training, and the sterile processing technician program. Those are the only ones they offer. They're limited, they're short, concise, and they're generally built for working people. So the courses run continuously. They don't have these semesters that only start in August or January. And they're designed for people who are already working to increase their credentialing and get themselves moving into a career in the health academy. So if you're not aware of it, especially my Macomb County people, I've worked with the Michigan Healthcare Academy. I feel very, very positive about the service they provide, the education they provide, and I would definitely take a look at them. The other one I want to talk to you about is Michigan Works. And Tammy, when she takes over, she'll really elevate the work that they do. But a lot of these programs that are non-credit bearing, you cannot use FAFSA or Pell Grant money because they're not credit bearing. And so that can prove to be a little difficult, obviously, for our students who can't afford to take some of these courses. But Michigan Works, you can refer your graduating student into Michigan Works who has a source of money that if they go through Michigan Works and they go to the Michigan Healthcare Academy, they go to Macomb's Workforce Continuing Ed program, or Ross or Dorsey, Michigan Works can actually pay for it that way. So it's a workaround around the FAFSA program. And they can also provide stethoscopes, supplies, anything that the student, any barrier, they try to eliminate every barrier the student has so that they can get into these trade schools or these career specific schools. So we don't have enough time to dig really deep into that, but my very last session of the school year is going to talk about short-term certificates, stackable credentials, and I will have Michigan Works on. I can't say enough good things about what Michigan Works can do for a young person. I think we always associate Michigan Works with unemployment, and that's not the only thing that they do. So keep that in mind, and you can follow up with me privately if you want to learn more about that access system. It's another great handout for you to give your students. A lot of our potential nurse students don't realize the grit and the grind that it takes to truly become an RN. So I like to use this handout with those students specifically. I give it to them all the time. And I say, look, you can go to the Michigan Healthcare Academy. You can become a CNA. You can work in nursing homes, hospitals, home health aides, while you're still going to school to matriculate through the RN program. It's giving you a more robust resume. It's really a great opportunity for you to know if you like it or you don't, and whether you want to continue your education. So I wanted to show this with you. If you Google Nursing Ladder of Success, you will find this PDF. It's been in my back pocket for many years. I use it a lot with students. We know that program length is important for students, and projected salary is more than anything. So this is a great resource. Before I hand it off to Tammy, I just want to give you a quick summary of a student that went to L'Anse Creuse High School in Macomb County, graduated in the early 2000s. His name is Brian, and this is a little, I'm just really proud of Brian's journey. Brian was a C student in high school. He was an athlete. He was a class clown. He jumped all around and moved all around in the classroom. He is the last person that people would have ever thought would go into the medical industry. Brian left high school and started off as an EMT. Because he was an adrenaline junkie, the thought of working in the field in that aspect was very exciting for him. When he started to work as an EMT for MedStar, he took a certificate program there, and he found out that with his EMT certification, he could go into the firefighting academy at Macomb Community College. While he was there, he graduated from Macomb Community College as a certified firefighter. He learned You either have to become a he learned to get a great job as a firefighter, you needed to become a paramedic beyond an EMT. He said, well, if I'm going to go become a paramedic, then maybe I should take a look at becoming a nurse. And so he worked as a firefighter. He got his wages in as an EMT, and he found out about how to become a patient care tech in the hospital. So if you don't know what a patient care tech, it's somebody who generally, if you've ever been in the hospital, they wake you up in the middle of the night to check your blood pressure. They make sure your pain is okay. They come in and check on you. They do a lot of nurses assistant type of roles, but they're elevated beyond like a CNA. So they have more responsibilities and they take vitals and things like that. While Brian was doing that, he saw all these opportunities at Ascension St. John Hospital, psychiatry tech. He got a certification in that. He eventually finished his associate's degree as a registered nurse. And he went on and worked as a registered nurse at St. John Ross for many years and started to plug away at that bachelor's degree. All the while, this is that squirrely boy that in high school that was playing football, playing lacrosse, barely made it through high school, had really no major plans, but he started climbing that ladder and it turned into an amazing career for him. Lastly, so this is Brian. He is a nurse practitioner now. Brian is my little brother. He was my first student as a guidance counselor. He's 8 years younger than me. Together, Brian and myself are first generation college students. I paved the way and learned the journey in education, and Brian figured it out with the medical industry. We both started off attending high school CTE programs, and Brian worked so hard to continuously grow as a medical professional. He is now working as an ICU nurse practitioner at Ascension in the city of Warren, Michigan. And it started off by going and getting an EMT certificate. If I would have told Brian, you're going to be a nurse practitioner and I want you to take all your education and get ready to do that at 18 years old, it never would have happened. But the fact that Brian could continuously immerse himself into a health pathway and always want more and always want to improve on his education, his experience, and grow in the profession. We just had to get that first door open for him. And that first door was becoming a certified EMT through MedStar. So use Brian's story. It's a great example to show students that you don't have to think about the finish line immediately. You just have to take that first step. So it's my pleasure to introduce you Tammy Stanton. She's going to take over and talk to you about the different access points within Ross Medical Education Center and the different things that they offer. So Tammy, the floor is yours, and I will just move your screens as you need me to.
Awesome. Thank you so much. Thank you. I am super excited to be here today. I actually, just to give you a little bit of background about myself really briefly, I'm actually a certified and registered medical assistant. Just like Sarah said, I've kind of just moved my way through education through the healthcare industry. I have been a medical assistant for the last 25 years. And then about 17 years ago, I went into education, and I found my passion with teaching students, teaching and helping them to become professionals and kind of bridging that gap between patients and physicians. So I'm going to talk briefly about Ross Medical Education Center, which is where, like I said, I've spent my last 17 years. And talk about our programs, hopefully answer any questions that you guys have, and bridge any gaps that you may have as far as how to send students to us, and if this is really the right path for your students. So I actually work at the campus in New Baltimore, but I know that we've got a lot of people that are from different areas of the state, and we actually have campuses all over the Midwest, Michigan, Indiana, Ohio, Kentucky. We've got campuses in Alabama. So we're kind of all over. So if you are in an area that you are looking to maybe send some students to Ross, I can definitely help to get you in touch with those campuses. So here at Ross, we actually, at this New Baltimore campus, every campus is a little different, but we have dental assistant, medical assistant, and veterinary assistant here on campus. Go ahead and hit next. The first one I'm going to talk about is our dental assisting program. And dental assistants they're not hygienists. They are going to be the people that are going to work with your dentist when you need a root canal, when you need any type of procedures that are done that are not a cleaning. Your dental assistant is going to be the one that's going to be handing the dentist the instruments. They can work as an endodontic technician, an orthodontic technician. They can work in oral surgery and periodontics, prosthodontics, like they're just all very versatile. And so dental assistants are a great pathway for those students that say, I want to be a hygienist. And because a lot of people don't know that they're not hygienists that are assisting the doctor, the dentist. They're actually dental assistants. And so that's a program that we have here on campus. With Ross, since the pandemic, we actually started doing both hybrid options as well as on-ground options for your students. The hybrid option is going to be where the students will come 2 to 3 days a week on campus, because we still are a hands-on program. And so we really do try to encourage our students to come hands-on or for the entire program. But some of the students are just, not comfortable doing that, or they're just not in a position to do that. So we do offer a hybrid option. Our programs here at Ross are 36 weeks, which is about 6 months, 6 to 7 months, depending on the program that they choose. Every one of our programs, after the students complete all of their modules, we work in a modular format. Once our students complete all those modules, then they are going to go ahead and go out on an externship. The externship is found by our career services team. So our students don't have to, who do I know that's in the dental field? Who do I know that I can go and get some experience with? Absolutely not. Our career services team goes ahead and sets those students up with the externship directly after their training. And then for 6 weeks or 180 hours, those students are going to work in that practice. I'm going to be in touch with them every single day, kind of just touching base. How's it going? Our goal is our student success. And I don't think I mentioned this. I'm so sorry. This is the first time I've done a Zoom call. I've usually been in person. This is a whole new thing for me, so forgive me. But I'm actually the associate director here on this campus. So my goal is student success. That's where my passion lies. That's where, I love seeing students be successful and working in the field. And so, like I said, our career services team is going to go ahead and set that student up with an externship. And then once they complete their externship, at that point, if they don't get hired from their externship, then career services is going to go ahead and work with that student until they are hired. Our students have lifetime job placement assistance, which means that forever, I've been here 17 years. I will have students 10 years later call me and be like, Ms. Jansen, I'm looking for a different job. I've been working in a pediatric clinic for the last 5 years. I don't really like it. I want to do something different. I'm like, absolutely, Susie, come in. Let's go ahead and get your resume updated. Let me do a mock interview with you. Let's talk about what your goals are. And so I will have students come here on a regular basis, and I work with them in order to help to filter them leads and to help to get them employed in a different position that, might be a better fit for them. So with Ross, students do have lifetime job placement assistance. So the chairside duties for dental assisting: they're going to prepare the patients for treatment. They're going to be handling the dentist instruments. They're going to be doing education with the patients, letting them know pre and post-op. Go ahead. Routine tasks, of course, they're going to be sterilizing. They're going to be setting up for procedures. They're going to be performing maintenance on different dental equipment. Go ahead. They're going to be working in the lab. They're going to be doing, go ahead. Sorry, I've already kind of talked about this a bit, but administrative duties. So what that dental assistant does is here on campus, we teach them not only back office proficiencies as far as the actual getting in there and working with patients and, working with the dentist, but we also teach them, and we have modules that are specifically designed for the administrative duties. So we talk to patients about, or to talk to students about, how are you going to talk to patients? How are you going to deliver information to them? Preparing the charts. We talk about billing. We show them how to do billing. We teach them the entire aspect of that office and how to perform those tasks. Because I have some students that come in and they think, oh, I don't want to do the back office. I thought I did, and when I got in there, I thought I did, and then I didn't really want to. So no problem. The program is multifaceted. So you're going to learn both front and back office skills. Now, our students, once they leave our program, they are all eligible to sit for, because we are accredited by what they call ABHES, which is the Accrediting Bureau of Health Education Schools. And ABHES has allowed our students to sit for the credentialing exams. And the credentialing exam that my dental students can sit for, my dental assisting students can sit for, is called the DANB, which is the Dental Assistant National Board. And the students sit for the CDA, which is the Certified Dental Assistant Credential. So those students, they can actually take, the DANB is actually 3 parts. However, when they leave here, they're only eligible to take 2 parts of that CDA, because the general chair side that you see there, they have to have, I think it's like 300 hours of work experience, and then they can sit for that 3rd part of the exam. So they will get those 2 parts once they leave here and they sit for that credentialing exam. Ross actually pays for that credentialing exam for both parts of the credentialing exam. And then the 3rd part is on their own, essentially, because after 300 hours, I don't necessarily always have connection with them anymore, because they're usually out there working. So so our students are eligible to sit for those exams, and we really hit on it. Like, we really want our students to sit for these exams, because that just makes them more marketable, and it's another stepping stone for them if they decide to go into hygiene, or they decide to go to dental school, which in the 17 years I've had a lot of students go into hygiene, and a couple have gone actually on to be a dentist. Go ahead. Now, my medical assisting program. So I'm going to kind of go through all of these, and I know I'm kind of crunched for time, so I don't want to take up too much of your time. But so I'm going to go on, and then if we have questions, I'll definitely answer those. But so we offer medical assisting here on campus as well. Again, it's the same gig. You've got the hybrid option as well as the on-ground option. With same thing, I really, really encourage my students to come for the on-ground education, because, you know, it's really tough. The online school it's not easy. You're teaching yourself, you know, and we have lectures that are online, and we've got you know, teachers that are available, but it's not the same as being in the classroom and bouncing those ideas off of one another. And when somebody asks a great question, you're like, oh my goodness, I didn't even think of that. But you may have thought of it at home, you know, at 11 o'clock at night when you were reading through your textbook, but you don't have anybody really to ask or to bounce ideas off of. So we really do encourage our students, at least I do on my campus here, to really consider coming on the on-ground option. So the medical assisting career, they're going to be able, that's okay, they're going to be able to, you know, work in a doctor's office, but there's a ton of different areas in which medical assistants can work. And one of them, go ahead, is going to be a laboratory assistant. This is a person that is going to maybe run some of the tests within a hospital or a off-site facility. We do teach our students within our program venipuncture, which is blood drawing or phlebotomy. We also teach our students, you know, EKGs and urinalysis, everything that is performed within the medical facility. Our students are going to learn, and they have to be proficient at it before they can move on. Again, it's the same thing. We've got 36 weeks of classes, and then there's 180 hours of externship for my medical assisting students. So they can become a laboratory assistant. They can be a chiropractic assistant, where in chiropractic offices nowadays, we're seeing more and more chiropractors using different types of equipment, different types of facilitative aids in order to gain you know, results and success with their patients. And so that's another area that many of my students have chosen to go. Then we have go ahead, the phlebotomist. Once our students leave our program, I have had many students go on and become a phlebotomist. Many of my students in this area have chosen to go and work with the Red Cross. The Red Cross is a great kind of segue into becoming a certified phlebotomist. Now, once our students leave, though, they can go on to the AMT's website, which is the American Medical Technologists, and they can go and apply to be a registered phlebotomist. And that is something where they could go then into the hospital and gain that phlebotomist position or attain that. So with a phlebotomist, they are doing lots of different skills within the hospital. They're drawing blood, they're blood banking, they are analyzing those specimens, they are just doing lots of different things within that hospital facility. Go ahead. Then we, of course, got the most common one, and this is within the doctor's office or outpatient facility. Also, some of my students, the same as the dental, they are going to both learn front office and back office skills. Learning both of those skills makes them much more versatile within the practice. And some of my students are like, when they first come in, everybody, just like Sarah said, everybody wants to be a doctor, everybody wants to be a nurse, and everybody wants to deliver babies. Every one of my students, when they walk in, they're like, oh, I really want to draw blood, I really want to give injections, I really want to do all the clinical stuff. And many of them they find that that's exactly where they need to be. Others, though, are like, oh my heavens, this is not what I expected. Like, I thought I was going to love drawing all this blood, but it's kind of stressful. And I really prefer doing the customer service portion of it, working in the front office, doing the prescriptions, kind of bridging the gap from the patients when they call to the practitioner. So some of my students find that, okay, I want to work in the front office, or I want to do healthcare administration. And that is where, you know, they find their passion. So there's many different avenues for my medical assisting students. Go ahead. And then with my medical assisting students, again, it's the same as with my dental students. Ross actually will cover the certification exam. So when our students graduate, they have a certificate of completion, which with that certificate of completion, that makes them eligible to sit for these national exams. These national exams are different than licensing, and they're different than licensing because these students can actually go to different states and practice. They can work. They don't have to attain by either reciprocity or by sitting for another exam within another state. So these are national exams. So my medical assisting students can actually sit for the registered medical assistant exam or the certified medical assistant exam. Because of the way that we are accredited, my students are eligible to sit for either one. There is no difference. Always the students will say, Ms. Santan, what is the difference? Why would I do one versus the other? Some healthcare facilities require one versus the other. It's just what they prefer. But all of my students are eligible to sit for both. I always tell students, though, don't sit for both. It's not necessary. It really isn't. Many places in Macomb County here will recognize the RMA. I always tell my students the RMA is a little bit easier just because it is more book work. It's more of the information that you've learned here on campus, and the CMA is more like critical thinking. Like, you know, patient presents with fruity smelling breath at the front window. What do you think you should do? Critical thinking, students are like, I don't know what I should do. So we kind of just try and I really encourage my students to sit for the RMA exam right out of school because they are prepared for it. We model our curriculum off of these tests. And so, of course, we want our students to pass these exams, and we have tons of resources here on campus and within their Canvas learning management system that are helping them to prepare them for that. So that's my medical assisting program. So my last program is my veterinary assisting program. Veterinary assisting, I hear from students all the time, I just want to be with animals. I don't like people. I just want to be with animals. And I say to them, that's amazing that you want to be with animals, but animals don't walk themselves in. Like people walk themselves in, so you still are working with people. So sometimes that becomes a bit of a challenge, but veterinary assistant is a great option for those students that want to potentially, or they think they want to go to tech school. Veterinary technicians are different than assistants in the respect where a veterinary technician is going to be the one that's going to draw the blood. They're going to place the catheters. They're going to give the injections. The assistants are going to be the ones that are going to help and do that. They're going to be the ones that are working with the boarding of the animals. They're going to be the ones that they can administer medications, but they can't do IV medications. So I like to think of the difference between a veterinary assistant and a technician is like a technician is a nurse, an RN, and then an assistant is like a medical assistant where they're able to do the tests with those animals. They're able to obtain specimens and prepare slides for the microscope for the doctor. But they're like, it's just a stepping stone into students that want to go to tech school. And within Macomb County, we are one of the very few that have a veterinary assistant program. And a lot of our students do move on to become technicians because they find that, you know what, this really is my passion. And they didn't have to spend 2 years to get that associate's degree and not work during that time. So with my veterinary assistants, they have surgical tasks. They're preparing the animals for surgery. They do post-surgical cleanup. They're doing instrument sterilization. They are just kind of getting everything ready for that surgery. And then they will assist in surgery with the veterinarian. Go ahead. Laboratory functions, as I mentioned, they're going to collect those samples. They're going to help to identify parasites within that animal. They're going to record laboratory results. They can do sensitivity testing. Go ahead. And then, of course, credentialing, same thing with, like I said, the other two programs, it's the same. Ross is NAFTA approved, which is the National Association of Veterinary Technicians of America. And our students are, once they finish the program, they're going to sit for the AVA, which is an approved veterinary assistant. This is the only certification of its kind that students can sit for anywhere. This is just our, this is the one that Ross actually again pays for, so that the students, again, it just is all about them gaining those credentials and becoming more valuable within the industry that they're going into. So couple of things I want to talk about before I ask any questions is Sarah had mentioned about Michigan Works. I just actually bridged with, her name is Leanne, and she is in Macomb County and St. Clair County. She's with Michigan Works. She actually does it's called the Young Professionals Program, and it is an amazing program. It is for students that are 16 to 24 years old. So this could be a great option for your students that maybe have, you know, they've decided to go on for their GED, or they're not wanting to, you know, they're 17 and they've graduated high school. This is a program that if you get them connected with Leanne in the Young Professionals Program, she will actually work with them to almost fully fund Ross's programs. And also the Michigan Healthcare Academy too. She works with that academy, which they have some amazing programs there that Sarah had already talked about. And so the Young Professionals Program is incredible. And many of my students have actually recently started working with her to get some of the schooling and the tuition covered. Now here at Ross, we're a little bit different in the respect where when my students start school, we give them everything they need. They are going to get a laptop because we have a Canvas learning management system program that we're using. They're going to get 2 sets of scrubs when they start, because that's mandatory. All my students have to be in scrubs. They're going to get a lab jacket because again, it's just, we want them to look professional at all times. They're also going to get all of their books, all of their curriculum, everything that they need. We give them a stethoscope, we give them a glucometer, we give them anything that they're going to need in order to go out onto externship and perform their duties or their job. We also do take FAFSA because since we are accredited by ABHES, we do work with the Department of Education and we do accept FAFSA money. And then there's also lots of grants out there that we help our students to attain. We have a financial aid department that helps our students to fill out FAFSA because it can be very confusing. And we help to work with the parents and the student to get them the most maximum reimbursement. Now, I know one of the big questions is going to be, okay, so how much is Ross, right? Because that's always the big question. Ross actually for the entire program is $16,000, which is a lot of money, absolutely. But most of our students, like I said, do get a lot of help with different types of resources that are available. And one of the biggest draws with Ross is the fact that in 7 months, our students are going to be working. And they're going to work. We actually we ended our last fiscal year, which started July 1st of 2020 to June 30th of 2021 with a 93% placement rate. That means that 93% of my students that started the program have finished the program. They're working, and that's validated by our education department. We call the offices, the hospitals, the facilities. We make sure that the students are working. So, and then as far as our retention, we are much different than, the colleges and the universities and even maybe some of the other trade schools. Our goal is for them to be successful. So I have tutoring scheduled. I've got my instructors that are here for office hours that are mandatory. The minute my students start to struggle in anything, they have assignments that are missing, I'm meeting with them. We are a very small campus, and being a very small campus, I have a finger on all of them, kind of following them around and being like, hey, Susie, I noticed you didn't turn 2 assignments in. What's going on? Do you need help? Are they not clear? Did you think you turned them in? What have we got going on? Which is much different than your high schools, because I know there's just so many kids there and just so much going on. Right now my campus currently only has 25 students in it in all of my programs. So I've got 5 and 6 students in a classroom. There's tons of one-on-one time with my instructors. So, okay, go to my question slide, because I'm sure there's going to be questions. All right, so what questions do you guys have for me?
So I'm going to jump in first and ask, so if I'm a school counselor and I have seniors about to exit in May, what is the timeline? When do semesters start? When should they apply?
Great question. The amazing thing about the modular system is that we have 6 modules in all the programs. The students can start every 5 weeks. Every 5 weeks, I have new classes starting. And what that means is that if my students, let's say my veterinary students are in module 2, and you have a student that wants to start in the veterinary assisting program, they can start in module 3. Each module is independent of itself, and the students just have to go through the entire rotation. So if they start in module 3, then module 2 is going to be their last module, and then they're going to go ahead and do their externship after that. So they can start every 5 weeks.
Great. Anybody have any questions? Feel comfortable to unmute yourself.
Awesome. All right.
That's good. That's because you're so good. And I will say in my work with all the different trade schools, I mean, cosmetology school is close to 16,000, 17,000. Trade schools, because they're smaller and highly concentrated, that is about the average tuition. Heating and cooling school, Northwest Tech, is about that as well, for 10 months of credentialing. But like you said, it's instant placement in most cases, and it's what it costs, but it's a shorter experience to get to the workforce. So Tammy, I'm so grateful that you came today and highlight this amazing program that you guys offer. Can you list really quick the cities around this Tri-County area that you guys are located?
Absolutely. So we have our campus here in New Baltimore. I've got a campus in Port Huron. I have a campus in Warren. There's Ann Arbor. There's Canton. We've got Flint, Davison. Those are the ones that are kind of closest to the tri-state area here, or tri-city area rather. But they're all over. Like we've got Benton Harbor, we've got Grand Rapids, we've got Kalamazoo. There's tons and tons, there's 44 campuses that we have. So,
Wow,
so there's lots of opportunity.
great. All right, well, if nobody has any specific questions, I